Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome back to another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and this week we have a returning guest, one of my friends and colleagues, Dr. Ralph Esposito. Dr. Esposito is a naturopathic physician, acupuncturist, and functional medicine practitioner specializing in integrative urology, men's health, and hormonal health. In addition to being a peer reviewer for medical journals, he has authored several medical textbook chapters and has designed education modules for health professionals, specifically on urological conditions, male and female hormone dysfunction, hypogonadism, exercise, men's health, and sexual dysfunction. So I am happy to have Dr. Esposito back on the show this week. Today we are talking about so many interesting topics, and he is giving us the latest on men's health. And one of the things that we're talking about this week is why are there an increasing number of men who suffer from sexual dysfunction? And, we're starting to see this at younger and younger age. And there is Actually, there have been studies that are showing that porn may have something to do with it. So we're going to be talking all about this. It's so interesting. And also about testosterone replacement. So it may be something that your partner may want to consider if levels are low, but we talk about some of the risks and the latest research on, does it affect heart disease? Does it worsen it? Is there a risk when taking testosterone and coronary artery disease? And recent studies show different. So check that out, as well as we talk a lot about intermittent fasting. It's sort of the latest thing that a lot of people I know, especially my patients, are talking about. So people who want to lose weight, there's intermittent fasting, and you can do it 2 days a week, depending on how you like to schedule it. And sometimes people will do 12 to 16 hours of intermittent fasting. So we talk all about that, some of the benefits, and actually some of the not so great things about intermittent fasting. So you definitely want to listen in on this week's episode. And if you have a partner that may be suffering from some form of sexual dysfunction, this could be something that you may want them to listen to, or if you just want to listen in this week. All right. Without further ado, on to the show. We have a return guest, Dr. Ralph Esposito. Thank you for coming back on the show.
My pleasure. I know that I feel like I'm a regular now.
I love having you on. Just to give a male perspective, ladies out there, even though you think this topic may not be, like a women's topic, I think it's really important for you to know what's going on with our men, whether that's a partner or a brother or a father. So let's dive right into the recent sort of men's topics that are super, super important. Where should we start?
Oh boy, where should we start? I mean, I have a pretty good list of resources where to start. I just can't pinpoint. But why don't we start a little bit about what men, or why are men experiencing a lot of sexual dysfunction in the past decade or so?
Yes.
Would you want to talk about why men? Why?
Absolutely.
I had one person comment and said, I don't feel like men have that drive. Like they don't chase me anymore. And I read that and I was like, okay, number one, I don't think she's hitting on me. so that was number one. But I was, when a woman comes out and says, I don't feel like men are chasing me anymore, then I get a little bit curious. Not concerned, but definitely curious. Like, why is that happening? I don't know. Have you noticed that in men lately or at all?
No. Um,
Okay, good.
sorry.
Good.
I mean, no, but I'd love to see what's going on. First of all, sexual dysfunction is definitely a topic that I talk to about with my girlfriends and certainly my patients. So when it comes to men, and
Yeah.
whether that's premature ejaculation or what have you. So let's talk about why this may be happening or why this is sort of popping up more and more.
Yeah. So there's a lot of theories as to why this might be happening. Um, I just want to give a little bit of a statistic to put things into a little bit of perspective. Now, this was done on European men, where I actually think that it's a little bit stronger. That the statistics are a little bit more surprising, being that they're in European men, because in Europe, pornography, or I should say, um, nudity is a little bit more well accepted, right? There's more nude beaches. I remember
Yes.
when I was going to Italy as when I was younger, like it would just be on TV. And it's like, oh, okay, like that's no big deal.
Right.
I remember my sister had like cassette players or cassette uh, album covers, and like there were like new girls on it. I was like, oh, you can't get this in America. So I think they're a little bit more accepting there. But the statistics are this: in 2002, the rate of erectile dysfunction among men between the age of 40 and 80 years old was 13%,
Okay.
which is pretty average, right? I mean, that means like one out of maybe a little bit more than 1 out of 10 men had erectile dysfunction between the age of 40 and 80,
Okay.
right?
Yep.
In 2012, between the ages of 18 and 40, up to 28% of these men had erectile
Wow.
dysfunction.
That's a huge jump.
Not only did you almost double the percent, but you halved the age,
Exactly. Exactly. So
which
what is
is
going on there?
it's fascinating to me because I think, and this is, let's put it into context, this the first sign of readily accessible like streaming online pornography sites began in 2006. So in 2002, the rate was 13%. In 2012, it was 28% of erectile dysfunction. And pornography sites that are basically, click on the website and you download it very easily, like you stream it like a YouTube, I guess. Um, those started popping up in 2006. Now, does that mean that pornography sites are the reason why we have erectile dysfunction or more erectile dysfunction among men now? I can't say it's just that, but clinically, it definitely is a factor in a lot of men's health issues for erectile dysfunction.
Mm.
And I'm sorry, go ahead.
No, that's interesting. And why is it that, okay, so yes, porn is so readily available now. I mean, you can just really go online and just watch, but
Right.
is it the fact, so why are people just staying home and watching? Like, why is that a thing now?
That
Why
well,
are,
that's a great question. I was thinking about this the other day. I have nieces and nephews from the age of like 8 to 15, and I wonder, like when I was younger, if I wanted to watch like my favorite TV show, I had to wait. Like I had to wait till like 3:30 till it came on TV. My half hour was my half hour, and then after that, I just went out and like distracted myself with other things. But now kids are on YouTube and they can watch their show whenever they want, anytime they want, how often they want. They can watch it over and over again. So they don't really have to go out. And I think that can apply a lot to pornography too, because pornography is basically like an adult's type of pleasurable TV or visual, or like it's their show, right? And I think men, what do they do? What they're doing is they're getting addicted. Basically, they get a high off of this pornography, off of this nudity, and it triggers them to just want to see it over and over again. And I
mm,
compare it. I compare it to. I hate to make this comparison, but to addictive drugs like heroin, or even, I mean, you see it too. I'm sure you definitely see it. People, they get addicted to certain foods like chocolate and sugar
Yes.
and, pizza and bagels. Like, it's the same type of approach, and actually does impact dopamine receptors, which is really fascinating
Wow. Okay. All right.
and
So
scary.
it is. It is. So now, you know what? Going back to that question about the woman, this is interesting too. I just thought of this. Okay. So that woman that said to you, I don't think that men are chasing me enough.
Yeah.
What about, and I'm just playing devil's advocate here. What about the fact that so many women are now in masculine positions? They're rising power, and slightly masculine. And maybe men aren't chasing because the women have become less feminine. I mean, have you ever thought about that? Do
I
you know what I
mean,
mean?
I no, I hear what you're saying. I know for myself. I mean, you know me. I'm kind of a, I don't want to say I'm an aggressive type of guy, but I definitely am. I set my presence, right? Like, I'm not, like, if a girl tries to dominate me in terms of, emotionally, physically, in a relationship, romantically, or even just tries to like bully me, it it pushes me away, and
Yeah.
I'm just like, this is not what I want, and it makes me feel a little bit less controlling. And I'm not saying I'm not controlling like you can't go out, but like controlling in terms of what is my role in this relationship. And I think that definitely can play a factor too, because men can be a little bit more intimidated by women. And I was actually, this comes into conversation a lot with like online dating, right? I was talking to a friend, and he was like, I can't go to a bar, I can't go to a club, I can't go to a social event, and where girls and guys are mingling and hanging out to hit on a girl, because most girls they don't really want to be hit on in public, and they kind of are a little bit standoffish. And this is not, I'm not saying women are doing this, I'm saying this is how men have been feeling, right? So if they're a little bit intimidated, and Amy Cuddy, are you familiar with her TED talk on posture and hormones?
Yes.
Right. So if men are feeling less confident, then they're going to show it. And you can people watch. I mean, in New York City, you can people watch at a bar or
Yes.
at in a park or something, and you're like, yeah, that guy doesn't have enough, you know, or he doesn't have his swag, or you can tell. I mean, you can. I mean, I'm sure you can tell. Like, if a guy came up to you and was like kind of like hunched over, like, hey, Margaret, like, think you're pretty, you know, what would you do? Like, all right, go away.
Yes, I would. Exactly.
So men are now relying on online dating. They're relying on, other ways to stimulate themselves. And when it comes to real life, it's not real. And then they realize that, and they can't perform when they have an actual woman in front of them.
And okay, so, but back up a second, because if a man were to approach me, yes, you're right. If a man approached me that way, I'd be like, um, not so much. I would, I mean, I'm not going to be rude to them, but um,
Right.
I think that I would never be standoffish if a man approached me if he was interested or just wanted to say hello. So the fact that your friend says that, I don't know. I think that if I'm out with girlfriends and or a couple of men like approach the group, which I think in a group that could be intimidating for one man. But if
Right.
he had a friend and they both came over to us, I think that there would be, I don't know. I mean, between me and my girlfriends, I think we would be very open to talking to them. We wouldn't be like standoffish or
Right.
anything like that. So I'm not sure. Does your
Right.
friend
And I don't.
experience this all the time? It's,
I think it is his perception.
mm,
And that's what I was trying to come to, is I don't think the women are doing this because I think, they're out, they want to socialize, they want to meet people, right? I think it's the perception. It's because I can only meet girls. The only way I can meet girls, the only women that I are familiar with are either online, like social media, or in pornography. And when it
Right.
comes to real life, they're just like, no, 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 that doesn't work. Like, this is not real. Like, there's no way, right? And then when men watch pornography, it's like, oh, it's my massage therapist, or oh, it's my nurse, or I have to be a pool boy, or something like that. Like they set these unrealistic expectations. But come on now, people have these fantasies or it has to be my nurse, right? Like that's like the age
I
old,
know.
like.
What is that? Yes. Yes.
And as a nurse, I mean, you're a nurse practitioner. You're definitely in a different category. But I mean, for me, I don't see what the big deal is about that. But it's not my thing. But certainly, like that's what men are experiencing,
Yes.
and that's what they. So what happens is that they're going on these porn sites, and the research shows, and it's funny, they did this research on military, which is interesting.
Okay.
Like, why? That's cool. But what they found is when these men were watching pornography, men who consistently watched pornography, they needed greater brain stimulation. Like they needed more. They called it extreme seeking. So the typical like romantic sexual interaction that is probably typical among most couples, it didn't do it for them. Like they needed like this has to be
right.
more bondage, or this has to be a little bit, or there has to be like two guys, or they called it more extreme seeking. They needed more stimulation, and then they became more desensitized. So it showed an addictive type of approach, because what is addiction? It's a little bit is not enough for me. I need more, and then more does not, and then you keep on giving more and more, and it doesn't do it for you, right? And that's exactly what they were showing in these studies.
Okay. All right. Wow. So interesting. All right. So
A lot there, right?
what's that?
I said there was a lot there, right?
There was. But this is so good to know, because I think that a lot of men watch porn. I mean, and it's pretty common, I feel. And I don't know. I think that there's definitely a fine line between when somebody just does it casually every once in a while and when someone's doing it often.
Right.
And what would you say often is?
Often with pornography?
Yeah. Of watching it.
I think in the studies they were showing it on a daily 5 to 7 times a week.
Oh, okay.
Yeah.
All right.
I think that's a little bit excessive. Now, look, I'll be completely frank with you. I haven't watched pornography since I started getting very deep into the research, and I was like, this is not good for my brain. Like,
right.
I don't.
That's what I'm thinking.
This.
Exactly.
Yeah.
I mean, it's actually changing your hormone levels, and it's creating sexual dysfunction.
Absolutely. It creates a psychosexual dysfunction. And it's that's performance anxiety. These men then have difficulty orgasming. They have and so then we're talking not just premature ejaculation, but delayed ejaculation, right? And that's funny because, when we think of like, when I don't want a 1-minute man, but having like a 45-minute man sometimes is tiring and problematic for the man and the woman as well, right? So, don't disagree with me here, Margaret.
I was going to say,
I heard it.
Okay. I won't say anything.
But there are women who are just like, this is, and it's dogmatic, it's repetitive, it's boring for them, right? And I guess it just depends on the man and their connection, but they have a decreased enjoyment of sexual intimacy. So they don't even, it's not even an enjoyment type of thing. They don't get satisfied. And the study showed that when they watched porn compared to partnered sex, they had greater brain activation via MRI.
Wow. Okay.
Yeah. So it's just like the research is not, it's pretty straightforward. Like this stuff should not be your daily thing.
All right. So let's say a guy is experiencing some form of erectile dysfunction. Let's talk a little bit about testosterone and when to sort of what's been happening lately with testosterone. Because I certainly have prescribed it for men and women. And so I'd love to hear what's new with that.
So I think a lot of the research now is coming out that testosterone does not increase risk of cardiovascular disease or cardiovascular events. It actually can be protective. So that's one thing.
Yeah.
And I think I live in a bubble, and I hate it because I post stuff and I talk about stuff, and then I have practitioners and people online reach out to me like, hey, my doctor doesn't do this, or my doctor's giving me a topical testosterone and I don't feel better. And I'm thinking to myself, like, if you are going to administer a medication, you should know everything about it.
Right.
Like, you should know how to use it, when to use it, what alternatives are there, how you can, and when it comes to hormones as well, right? Like,
Totally.
like for example, with thyroid hormone, if I see somebody's reverse T3 is, at 25 or 30, and their T4 is high, but their T3 is low, I'm not going to give them T4 because it's just going to go to T3 to reverse T3. Like, that, right?
Right.
Well, you know that. Margaret
Yes.
knows that, but a lot of other people don't know that.
Right.
Right. So when it comes to hormones, I don't think a lot of practitioners understand the intricacies of hormonal replacement therapy. And so,
well, I don't even think that people are testing for reverse T3.
yeah, I mean, okay, that's a whole conversation on its own.
I know. Totally.
And then, I mean, we've had this conversation before, like, what should you test for testosterone levels? And most men, most doctors are just checking testosterone and maybe free testosterone, maybe. Like, not looking at LH, not looking at FSH, not looking at estrogen, not looking at SHBG, not looking at all these other hormones. So when they tell me, oh, testosterone replacement is dangerous, or this guy it's not going to help him, or, he's diabetic and this is going to increase his risk for cardiovascular disease, that is not true. In fact, there's a lot of research coming out now showing that men with diabetes, type 2 diabetes, improve their body fat percentage. They improve their hemoglobin A1C levels. They improve their insulin sensitivity with long term. I mean, like 12 plus months of testosterone replacement therapy.
Mm.
And that, I mean, most men don't even go on testosterone replacement therapy for more than 3 to 4 months because of issues with shutting down the HPG axis, the hypothalamic pituitary gonadal axis, which can happen, certainly can, and that is a real concern. But it does not mean that it's completely a useless therapy, and you should know how to use it properly. So I think that's one of the newer things that I don't think clinicians are using it as a therapeutic, because it really can be very helpful in terms of improving metabolic syndrome and those things.
Yeah. Okay, so what else with testosterone? Yes, I did read that study that it doesn't increase any risk for coronary artery disease. And so what do you think about giving men, and I know, getting all the proper blood work, what do you think about giving men testosterone replacement?
I think you need to figure out if it's primary or secondary hypogonadism, right? Mm-hmm. So if the LH and FSH are really high and the testosterone is low, that tells me the testicles are not responding, right? And what I typically would say is, let's try to exhaust a physiologic approach. So I like HCG and clomiphene citrate, to see if we could just wake the brain up just a little bit and say, hey, scream at your testicles and say, hey, make more testosterone, right? Like, push these guys to the limit. And if that doesn't work, or the guy's like, I really don't feel a difference, then I would say, okay, it might be an option to go to straight testosterone replacement. But you also have to consider how old the guy is, right? Because if he wants to have a kid anytime soon, you have to tell him, like, look, if we do this for like 6 months, we run the risk of shutting down your testicles, having atrophy, and being unable to recover, and having to go to like HCG and Clomid and sometimes they even do FSH stimulation. So it's really hard to say, like, what is the best step. I'm not opposed to it. I certainly am not opposed to it, but I would like to exhaust my options first. And then, is it a sleep issue? Is it a diet issue? Is it a adrenal issue? Right? Because the adrenal glands make a lot of the precursors for testosterone. So there's a lot of factors that I would definitely go into first. And I would caution I know most of your listeners are women, but I would caution them to advise their men, right? Because as we've discussed before, the key to a man's health is his partner or his wife or his girlfriend. Um, to kind of understand, like, what is the underlying trigger here? What is the antecedent that has set this up? Let's correct that first, because then you're just going to be shooting yourself with testosterone for the rest of your life, and that could be inconvenient. And then you come down to other issues when it doesn't work anymore, and it's you have to address all aspects.
Yes, absolutely. All right. And then there was also something about estrogen. Let's quickly touch on that.
Yeah. So a lot of what I hear a lot from men is it's like the caveman approach. It's like testosterone good, estrogen bad, right?
Right.
Okay, like we get it. I understand that testosterone is a male thing. Like it makes you feel macho, makes you feel strong, and it's why we have an XY chromosome or chromosomes. Um, and estrogen is bad because estrogen is for women, and that's why it's bad. And Margaret, you know me. Like my approach is I just want to teach people.
Yeah.
I want you to know what I know, and because I can't help everybody, I want you to be able to be your own advocate.
Right.
And part of that is understanding what's going on. And if you don't understand why estrogen can be problematic, then you're sitting in a simple mindset of estrogen bad, testosterone good, and you're lost.
Right.
And yes, and you would not be able to work on correcting the issue down the line. So a lot of what I try to explain to people is that estrogen is problematic for men, mostly because estrogen can bind to receptors in the hypothalamus and pituitary. So the two parts of your brain that are responsible for making the hormones that tell your testicles to wake up and make testosterone, right?
Mm-hmm.
And the reason why estrogen is problematic is because when that gets very high, because there's two things that could turn off your brain in terms of making testosterone. It's high testosterone, which is smart, right? It's like my testosterone is very high. I'm going to go upstairs and tell the brain, shut down a little bit, like stop making so much. So it's a normal physiologic response. But when estrogen is high, it does the exact same thing, regardless of your testosterone levels. So you can have super low testosterone levels. Like let's say your testosterone levels are at like 200. That your brain should say testosterone levels are at 200. Let's make more. Let's make more testosterone.
Mm-hmm.
But when estrogen is high, it says no. Estrogen is high. Don't worry about it. We're going to shut you down, and we're not going to make any more. And that inhibits your body from making testosterone and estrogen. But the problem is that we have so many exogenous sources of estrogen, and men can convert a lot of their testosterone to estrogen.
Right.
So they're making more of these estrogen compounds, which are, it's like a vicious cycle. It's like more estrogen tells the brain to shut down more, which then makes you make more estrogen, which then lowers your testosterone levels even more. And it becomes difficult to tackle, especially for men who, are overweight, they have obesity, or they have like a lot of belly fat. They're beer bellies, right? They eat a lot of sugar or carbs, and that in the end is just, it's shutting them down in the long run.
Yes. Yeah. Big time. So one last thing I wanted to talk about, since we're talking about belly fat, since you mentioned that, let's talk a little bit about intermittent fasting. I'd love to hear your take on it.
Yeah. I love naturopathic physicians. I love functional medicine docs. I love integrative practitioners. I love them because we're always on the cutting edge. We're always on the cusp of like what is new. Like naturopaths have been talking about fasting for decades. Water
Right.
fasts.
Right.
This other thing too is contrast hydrotherapy. It's like, I'm going to do cryo and then I'm going to go in a sauna. Mm-hmm. That is called contrast hydrotherapy, which is developed out of Germany in the 1800s. And they would put people in like an ice bath and then, or like spray them with cold water and then like throw them in a and like a warm bath, right? And they would do that back and forth because they knew how it impacted their autonomic nervous system.
Right.
So now it's like it's a trending thing. It's a biohack now. I just call it an ND original, like an OGND approach. But fasting,
Yeah.
we know that intermittent fasting has a lot of good benefits.
Yes.
Or fasting in general has a lot of good benefits. It induces autophagy, which means it's like your cell cleanup. It can recycle or improve your immune system, has been associated with longevity. But from a hormonal aspect, it can cause a lot of havoc. And it does that a lot to the hypothalamic pituitary thyroid axis. So it can, when you fast, it will stimulate, or your thyroid will typically go in basically like low battery mode. It's like, okay, not enough energy here. We're going to shut down and go into low battery mode. And then you start making less thyroid hormone. And it actually can impact the synthesis of your reproductive hormones. So it actually can shut down your synthesis of testosterone. And there was one study, there's not a lot of studies on this, but there's an accumulation of multiple different studies where I put them together and I say, looking at these together, I see why fasting can be problematic. And there was one study where there were athletes who were doing 16/8 intermittent fasting, and they improved body mass, body composition, they improved muscle mass, they reduced their body fat percentage, but their testosterone levels dropped.
Okay.
Significant, right? So now I'm thinking, okay, so the testosterone levels dropped, so what? Like they looked better, they improved their body composition. But my question is okay, well, how did that translate to the way you felt? How did that translate to your performance in the bedroom, right?
Right.
And this is, a lot of the studies are done on Ramadan. So where the Muslim culture, they fast, right?
Yes.
From like sunrise to sunset.
Yeah.
So typically could be a 12 to 14 hour fast. Sometimes they even go longer. And a lot of these studies were showing that there might be a decrease in sexual desire among these men doing Ramadan, during the month of Ramadan fasting. So I'm using a real life example in combination with a little bit of studies to say, you don't want to do this too much. And I think intermittent fasting is very healthy. I think it's perfect, and in terms of improving body comp, although that's a little bit arguable. But if you're having hormonal issues, if your thyroid is sluggish, if you're having low testosterone, if you feel like you just got hit by a train and you can't get up in the morning, perhaps intermittent fasting is not the best for you. And I see this all the time where people are keto, they fast for like 18 hours and then they go ahead and try to like squat and deadlift. And I'm just like I understand I understand that you're trying to deplete your body of energy and like burn fat, but
right.
Think about what you're doing to your hormones. And, I could even give you a list of studies. I'm presenting on this, with Dr. Kerry Jones in the fall at the New York Association of Naturopathic Physician Conference. And this is one of my several slides. And I have about like 7 to 8 studies just on this topic. So I'm happy to send those over to you or your listeners if they have any questions. Yeah, it's really good information.
Okay, so how many times a week do you think someone safely can do intermittent fasting? Because I know that people definitely see results. They feel really good doing it, and their bodies look amazing. And I actually have not asked them or seen their blood work about testosterone levels, or have yet to hear that performance is lacking in the bedroom. So I have heard people just doing it like twice a week. And so what do you think is a good number of days to do it during the week that would be safe? Obviously, someone that has got low thyroid issues and can't get out of bed in the morning, I think probably address the thyroid issue first before going forth and doing intermittent fasting. But what would be a reasonable number of days during the week to do?
I would say do it on days you don't exercise.
Okay.
So, I mean, I'm one to speak, right? Because like I probably exercise a little bit more than the average. But if there are days where I'm going to be very low activity, I'll fast till noon, right? And I'll do a 16, 17 hour fast. But I would say if you're training every day, if you're an athlete, it might not be the best option for you. Certainly, it depends on your individuality. Now, um, a lot of athletes are doing intermittent fasting, and these are prime athletes. Like they're very fat efficient and they're metabolically efficient. So it might be fine for them. But the average person who's like intermittently fasting, exercising, and then like sitting at a desk all day and getting yelled at by their boss, like that might not be the right amount of balance in terms of their stressors. So I would say several days a week is fine, and certainly try to avoid it on days that you're exercising.
Okay. And so, like, well, if someone's exercising 5 to 6 days a week, then they're really only
Yeah,
doing intermittent fasting like twice a week, maybe once to twice a week.
right, right. So it depends on the intensity of the exercise. So
Okay.
if you're weight training, I would say you might want to like the high intensity type of stuff. Like I wouldn't go to a CrossFit gym and be fasting for 18 hours and then try to like get your heart rate up to 200, right? Like that just might not be the best option for you. So I would say you can do it even on the light exercise days. Like I have a light day and then I have a more intense type of day. So I would say try to keep it to a minimum. But again, I'm not saying intermittent fasting is bad. And by the way, this is for fasting, right? So we're talking longer periods than 16 hours. And one study showed at 16 hours it impacted testosterone levels. And in other studies, Ramadan studies, those are 16 to 18 hours,
Yeah.
right? So maybe they can still do intermittent fasting and just do like a 14-8. I'm sorry, a 14-10.
What do you mean by 10? 14
14
hours?
hours fasting, and then within those 10 hours, they can eat.
Oh, okay. Yeah.
So it really depends. And you have to personalize this, right? Because I know I'm going to get like a lot of, smack talk from people like, no, intermittent fasting is like the best thing ever. And yeah, it definitely is very effective. Like, evolutionarily, it makes sense. But also evolutionarily, we didn't have a lot of these stressors that we're dealing with on a daily basis.
Exactly. Exactly.
Balance.
All right. This was such a great, I loved all of these topics. I think super, super good to know. And I think for the ladies out there, it's really important for you to know kind of what's happening in the men's medical world. And how can people find you?
The best way to find me is probably be on Instagram, at dr.ralph.esposito, just my name, and then my website as well, drralphesposito.com. I do, you know, fiddle with Twitter, but mostly just to like retweet a lot of great stuff from a lot of other, bright minds. And so mostly Instagram and my website for sure.
And do you work with patients now?
So right now I'm working as a medical consultant, so I'm not. I work as a medical consultant and a research analyst in a medical practice in New York. So I'm kind of the like second brain in the practice. But a lot of practitioners do reach out to me and they have, questions about their, their Dutch testing or their blood tests. And so I don't deal with patients directly. I wish I could. I just don't have the bandwidth to be somebody's primary doc that they're just,
Yeah,
on call with. My brain is just, I mean, look, we couldn't have spoken about these things in such in depth if I didn't do that stuff.
exactly.
So,
No,
so
exactly. And you're
yes.
my go-to when it comes to men's health. So
Oh, thank you.
I text you every
Yes,
so often with some good questions, and you
they
always
are good
get right back to
questions.
me. So I appreciate you for that.
Of course, anytime.
All right. And let's see. I think that's it. Any last things that you wanted to add to today? If anything that we maybe didn't hit upon or touch upon?
I think the bottom line when it comes to fasting and sexual dysfunction is you need to really be in touch with your body and listen to your body. And I don't think a lot of people are doing that. I think they're just they're follow like the research says do this, or my doctor said do this, so I'm gonna, follow that to the T. And I am an excellent direction follower. Dr. Gabrielle Lyon, who's like one of my best friends, like if she tells me like, Ralph, you do this, I'm okay, done. Like consider it done. But I also want people to listen to their body, and when your body is telling you like you need more sleep, like always sleep over everything. Just make sure your men are not pushing themselves into the ground, because men will do that and they want to
Yes.
impress people and they want to be that like breadwinner. And sometimes it just doesn't have to be that way. So just send that message to them, and I think they'll find their way organically.
Okay. And three really quick questions that I tend to end my
Hmm.
interviews on. Let's see. What is one of your favorite apps?
Oh, one of my favorite apps, like on my iPhone.
Yeah.
I really like using Insight Timer, which is a meditation app, and I do that every day.
Oh, I have to look into that.
Yeah,
How do you
it's
spell it?
free, and
Is
they have Insight, like INSIGHT,
GHT?
and then Timer. Yep, Timer.
Okay,
Great
cool.
app.
Let's see. What is one of your guilty pleasures? Like, what do you don't mind spending a lot of money on?
Food. Any food. Any food that makes like that is. I never skimp out on food.
I
Like
know.
if
Me either.
ever, like if I had to pick between like if I had to go to the store, like, oh, these are like $3 like Brussels sprouts, and these are $1 Brussels sprouts. I'm like, I'm bringing the $3 ones because these are good. I never skimp out on food. But I don't go that rule does not apply to wine. Unfortunately, more expensive wine does not necessarily mean better. So I will pick the better tasting wine, not necessarily the more expensive wine.
And are you like gluten free or dairy free?
I am not gluten free, dairy free in terms of celiac. I avoid it as much as possible. I don't eat wheat. I don't really eat dairy. I'll maybe have on occasion like a little piece of feta cheese if it's in a salad or something, but I, for most part, try to stay away from it. I cured my IBS like throughout my whole life, and I don't intend for that to be a frequent visitor anymore. So keep that out.
Nice, nice. Oh, I'm surprised since you're Italian. There's lots of cheese.
Oh my God. And pasta and pizza. It's like, what the heck? I
By the
know.
way, I did consume a little gluten when I was in Italy, as per your okay.
Yeah.
Yeah.
Well, when I'm in Italy, I can eat the mozzarella there. I can have the pizza there, and it doesn't do a thing to me.
Yeah, it didn't for me either.
I think it's the type of wheat. I think it's the type of dairy that they use. My uncle is a butcher in Italy, and he'll always tell me, he's like, we won't buy American meat. He's like, it's just not good. And I was like, oh, that makes me feel better.
Oh, nice. And what is like what's your biggest passion right now?
My biggest passion.
Yeah.
You know what? I am like
What's your
head over
obsession?
my
Yeah, I
obsession.
mean,
What
well,
am
is
I
it the same
obsessing
thing?
over?
Is it the same thing?
Well, I'm very passionate about my work, right?
Yes, I know.
So I don't know if that is an obsession. I've actually been obsessing over. What have I been obsessing over? Oh, you know what? I've been obsessing over glucose monitoring.
Really?
Um, yeah, I've been using a something called a Dexcom, which is a continuous blood glucose monitor.
Okay.
And I'm like, after I eat, I try to see where my blood glucose levels are. And
Okay.
like, I had a banana today, and I'm amazed at how insulin sensitive I am, because like I grew up a fat kid, right? And I was just like, oh man, I'm fat because I can't store insulin very well. My sister, my brother, they struggle with weight issues. I was like, I must be me too. And like my blood sugar is pretty stable. It's really, really cool. And then I notice that when I don't sleep well, my blood sugar stays elevated a little bit higher, and it could be from elevated cortisol levels. So that is my most recent infatuation.
And so are you doing these as finger sticks? No,
No,
they're
it's a
continuous.
continuous.
How
Yeah. Yep.
how are you how what's the technology with that?
It's a device called the Dexcom, and it will measure your blood glucose every 5 minutes, and it's very, very accurate. So you basically just like stick this little transmitter thing on your belly, and it will constantly measure your blood glucose, and it goes straight to your phone.
Oh, that's amazing.
Yes, really, really great tool. And I would tell people, you don't have to do it for the rest of your life. That's used for diabetics, right? But I'm not diabetic, but I want to see, like, what does a banana do to me compared
Yeah.
to a bowl of cereal, compared to, like I had a meal last night. It was a very big meal. It was like a hamburger and then a piece of like chicken breast and then a ton of vegetables. And it was a very dense meal. It must have been like 1,000 calories. And but my blood sugar did not go above like 86, 87.
Wow. That's awesome.
Yeah. And it shows you like there was no carbs in there. There was no high glycemic foods, and it shows you what it could do. And like this morning I had a banana, half a banana, and like my blood glucose shot up to like 105. I was like, oh, okay. Now I know what it does.
You had the banana by itself with nothing else.
Right. And then I ate after.
Okay.
Yeah. Yep.
Fun
Fun
cool.
stuff.
I'm definitely going to look into that. I love doing shit like that. So
do it.
I'm constantly getting my blood work done like every couple of months, checking things and monitoring things. And
yeah.
Yeah. I know. We think alike. All right.
I think that's fun.
Ralph, thanks so much. You've been awesome as usual. And let's stay in touch. Let me know when there are new things to talk about. I'll have you back on the show for sure.
Of course. Yeah, you can find me in New York. I'll be there.
Yes, we definitely have to meet up soon. What an enlightening conversation. I hope you learned so much from this interview with Dr. Esposito. To learn more about him and for all the show notes, head on over to margaretromero.com/episode 95. And if you are not following me on Instagram, head on over to Margaret Romero on Instagram. And I will talk to you all next week. Bye for now.